Afternoon. Hi, Malishka. How are you? Okay, so today is our on YouTube Mythbuster Friday, and the question today that I am taking up is, corona virus or corona infection is decreasing. The myth that the corona infection is decreasing. Now, why I'm saying it is a myth, because we have been seeing certain other areas like Delhi the other day or some few days back had a sudden rise of 8,000 cases. Okay, then there are certain countries which have gone into lockdown. I've already made a post about this countries which have gone into a second lockdown, that is after having low cases they started having their opening up of the businesses and opening, what is it, the unlock phase, and following that again they have gone into lockdown. Now, what is the reason why the secondary lockdown has to be done? Because of this myth that yes, corona is gone, now I can do what I want. No, corona is not over, it is still there. Okay, it will be there for some time, because things just don't happen as a spike and then just go down. Okay, it will be there for some time, so we have to be careful now, especially during this Diwali season. Now we have already started with the Diwali. Okay, so with the Diwali season there'll be so much of shopping going on. People are already coming in the markets, and I have been seeing so many posts wherein, somewhere in Maharashtra, there's so much of crowd in one place that the post said, okay, corona la, what is that, the एवढ्या गर्दीत चेंगरून कोरोना मेला. Okay, that is, there's such a huge crowd that even corona got smashed in that crowd. Okay, so this is just for fun's sake, but things don't happen like this. If you are hit by a disease, you will only understand how irritating it is, how disappointing it is to go through that pain. Someone who asked me, I think Lutz has asked me, hi doctor, what happened to your hand? So Lutz, what happened is today early morning I was hale hearty, did my exercise, everything done, and I just went to have bath, and I had severe tummy pain. I mean, I had real severe tummy pain which I'd never had earlier. And following that I had to actually cancel all my OPD, so I cancelled all my appointments and I went to my gynecologist, and to my surprise I had a pelvic inflammatory disease, that is the infection of the ladies this thing, genitourinary system, which was like out of a blue, something really out of a blue. And following that early morning I was in the hospital, I was admitted for some time. This is the injections that I had to take, and I'm just back home. Since it was 1 o'clock, I didn't want to cancel. I'm okay. I mean, I'm not wincing. Yes, in the morning I was really wincing with pain. I couldn't stand, and I was really a patient that time. A doctor patient. So even when I went to the hospital, all the this nurses and doctors, they're like, "Huh, doctor, you have infection." I mean, doctor is not some immunity to get infection. We can get infection. We are also human beings. We also have to go through all those pains and everything that every common man has to go through. Okay, so that's the story about this. Okay, that's a part. But I didn't allow that to affect my schedule. Like, I was just telling my husband, we are just back from hospital. He just parked car. I said I will just finish it off. Like, it's just 10 minutes. We will do it. Okay, so that's how I'm doing it again. So today's myth was basically this: that don't feel corona has gone out and you can freely go around. Follow your SMS, that is the safe distance. M is for the mask and the other S is for the sanitization. Don't visit many places. See that as much as possible. Restrict your visits to outside. Yes, today is the Narkasur Vadh day, so many people will be going out to see the Narkasur. Okay, but I would request as much as possible, please do not take out the senior citizens outside. Please do not take out the children outside. Even if you take, see that you go in a car and the Narkasur can be seen through the car. Please do not get down, go close to that Narkasur, because a big crowd there. There'll be crowd of all those children, all those people who have made that Narkasur, and they'll be dancing there for sure. So please do not mix up, because you are going to add more to that crowd and it's going to increase the crowd. So I would really appreciate if you can just listen to this, that even if you go to see the Narkasur, see that you do not go out and go close in that in the crowd. Also, you can just see the Narakasurs which are around you in your place. Okay, that would be a better idea, because you can even enjoy that Narakasur from you seeing the Narakasur, at the same time you can be safe. Okay, so that is very important. That was the only reason I came online, because I wanted to what is that, request people not to go out in the this thing crowd. Follow your SMS, that is the safe distance, mask and the sanitization, so that you do not get affected. Okay, that was one of the myth. If I just yes, so thanks for all the good wishes. Yes, I am definitely taking care of myself. At the same time, I have been doing all other things also at home which are required for the Diwali, because Diwali is one of our big celebrations, like how Ganesh Chaturthi is. And you know, everyone has happiness in having those small occasions, small festivals. Yeah, we do like them. Okay, so we do follow those rituals, following, making all those chaklis and nyoris and everything. We really enjoyed. So coming back to the myth. So one myth is, as I said, corona is decreasing. No, it is not decreasing. It is there and it is affecting people. Second myth which I came across, because today morning what happened to me, that doctors are always healthy, doctors don't have to go through the pain. And no, we also have to go through the pain. We also have to maintain our health. If we don't maintain our health, a doctor can also be a patient. In spite of maintaining my health as much as possible, you know, I'm very health conscious regarding the food, regarding exercises, regarding drinking water. I'm very health conscious. Still, I had to go through this. Okay, so it is destiny. At times it is destiny. Even after doing everything else, you can get affected. Rather, the doctor who was looking after me, Dr. Sachin himself, said, you know, Poonam, you are an inspiration to everyone. Okay, and you are so positive that you emit the positivity. I was like really happy when I heard that. And yes, emitting positivity is something very good, and it is something that we should do, everyone should do. And as a doctor, or as anyone who is a public figure, I feel we should try to affect the other person, or give the effect to the other person of positivity, emit that positivity, so that the other person also thinks positive, is starts having a better lifestyle. Okay, a good lifestyle, exercises are incorporated, and so many other things. Okay, so number third myth that I want to say today, again because of my problem today, is not that having a good lifestyle is going to keep you away from all the diseases. Certain diseases do not look after your, I mean, do not come hit you just because of your lifestyle. Infections can affect you even though you have a good lifestyle. Okay, so it is, certain things are destiny, you have to accept them, but that doesn't mean to say that anyways, if I am going to be affected by disease, why should I spend my time in changing my lifestyle? No, your lifestyle has to be the best lifestyle that is possible. Okay, I think that makes it for today's talk. We discussed 3 myths. Okay, and Lutz says, how nice of you to come online. Really appreciate your work. Thank you, Lutz. Okay, Nipsila, hi. Hi, Melishka. And yes, Melishka, everyone who is online with me. I know YouTube, little bit less people are there. Tomorrow is Diwali itself, so I won't be online tomorrow because I'll be busy in my own house. And Sunday again, so I won't be online. So we will meet directly on Monday, on Vaccine Query Monday. Happy Diwali to everyone, and lots of love and lots of sweet dreams and lots of sweet days to everyone for the next weekend. Okay, I mean this coming weekend. So see you. Bye bye. Me, Dr. Poonam Sambhaji, signing off for today.